Okay, thanks for joining us tonight. We're going to go ahead and get started. We are excited to present the third in a series of 6 webinars with the fun theme of You're a Doctor, Now What? This series is being brought to you by the National Medical Health Collaborative, which is a nonprofit entity that's been established by the Arizona Medical Association, the Missouri State Medical Society, and the Wisconsin Medical Society. The collaborative has a mission to promote and advance the healthcare field by providing education, policy development, and resources aimed at improving the delivery of patient care. Tonight's webinar will be focused on a couple of important topics. We're going to hear from 2 distinguished speakers. As I mentioned, our first talk is presented by Dr. Lisa Shah-Patel, and she will speak on the topic of choosing a specialty. Dr. Shah-Patel is the Director of Career and Professional Advising at the University of Arizona College of Medicine, Phoenix. She leads a team of physicians all dedicated to supporting medical students throughout their medical journey in a variety of capacities that are important to their success in school, residency, and specialty careers. Dr. Shah-Patel completed a 7-year combined biomedical sciences Doctor of Medicine program and received her medical degree from UCLA School of Medicine, followed by radiology residency at St. Luke's Roosevelt Hospital in New York. She completed a fellowship in breast imaging at Mayo Clinic in Arizona and currently works as an independent contractor, reading screening and diagnostic mammograms and performing ultrasound-guided procedures and stereotactic guided biopsies. In her free time, Dr. Shah-Patel enjoys spending time with her family, going to the beach, skiing, and traveling. Dr. Shah-Patel, we are delighted to have you on the call tonight. I'm going to pull up your slides, and then the webinar is yours.
So we're going to go ahead and get started, and I just wanted to share with all of you some statistics about choosing specialties. Based on the AAMC 2020 report, 26% of medical students pursue their initial specialty choice. Based on both Canadian and US reports, previous studies have demonstrated that the residency preferences of matriculating medical students changes by the time a final residency choice is made at the end of medical school. Next slide, please. Notably, students have demonstrated a persistent tendency to categorically switch preference between primary care and surgery. And as reported from the 2015 graduate questionnaire and medical matriculating student questionnaire, 1 in 4 medical school graduates end up in the same specialty they picked the summer before they started medical school. Next slide. So based on these statistics, how do you all choose a specialty? So much of this process requires not only experience and exposure, but true self-reflection. The more you get exposed to things, the more you figure out what you like and what you don't like. And that doesn't necessarily mean just shadowing experience, but also material that you may be exposed to during your actual coursework. Reflecting back on how you got into medicine, how you knew you wanted to become a doctor, what experiences or influences led you to be here today, and also reflecting on where you see yourself in 5 years, 10 years, 15 years. Think about what your immediate and future goals is, and that's really important to this entire process. Next slide. So today I want to go over some thoughts and ideas on the process that you can use to help you choose a specialty. Next slide. As a first and second year medical student, where do you start? There are so many stressors that you all are experiencing. Some of you may not have anyone to guide you, may not have any family members that have gone through the medical school process here. Some of you may be stressed with figuring out how to distinguish yourself. Now that step has gone past fail, what do you need to do? How do you find those shadowing opportunities? Who do you talk to? Next slide. So let's start thinking about your values and what's important to you. Let's dig deep. Do you value achievement and recognition or scholarly pursuits and knowledge? Is compensation and work-life integration important to you? Service and personal fulfillment, personal relationships, autonomy, collaboration, management. I'm not asking you to choose just one of these. I'm asking you to think about what your top 2 or 3 or 4 of these may be, and hold those true to yourself as you get exposed to more and more specialties. Next slide. What can you do right now as first and second year medical students to get exposure? How can you showcase yourself? The first and foremost thing to do is to talk to your upperclassmen, your lecturers, your mentors, alumni. Get involved in interest groups. Get that exposure to what a specialty is all about and talk to those that may be in those specialties. Networking is huge right now, especially because STEP has become pass-fail. So the more people you have in your court locally, the better off you're going to be. And this is a little bit where social media comes into play. So I'm not a big social media person at all, but social media can lead you towards a variety of individuals who want to mentor, who are willing to help. Joining the student portion of national organizations is also really important. Utilizing resources such as the AAMC Careers in Medicine, which I'm going to talk about in quite a bit of detail, and getting involved in research is also important. Next slide, please. So the AAMC Careers in Medicine is a phenomenal resource for all years of students. The framework of the Careers in Medicine relies on 4 stages: understanding yourself, exploring options, choosing your specialty, and preparing for residency. The first portion of this 4-phase model is understanding yourself. And this phase includes a few different surveys or inventories that you can take, one of which is called the Medical Specialty Preference Inventory, which helps identify or confirm your preferences for various aspects of your medical practice. This is a 150 question inventory. It'll take you about 20-25 minutes to fill out. And at the end of it, it uses an algorithm to predict the likelihood of you entering certain specialties. This will change as you increase your exposure and experiences to certain material and fields. So your advisor or you yourself may have you take this 2-3 different times throughout your medical school journey. These are the different inventories which are available as you work towards understanding yourself. Each of these has a different focus, including your values, your skills, and a specialty and decision scale. The residency preference exercise, which is on the bottom right of your screen, is a separate exercise, which will allow you to tease out what programs you would like to apply to based on your desires. So the medical specialty preference inventory, this is an example of what you may see. And these are examples of the types of questions that you may come across and the scale used. In this example, they're asking what type of practice you would like to be involved in. Would you like to be in a practice that deals with incurable diseases, or a practice that uses routine laboratory tests in making your diagnosis? And you can see there's a scale here of low desirability to high desirability. Next slide. After you complete all 150 questions, you end up getting scores like you're seeing here. And basically, this shows that the higher the number that you see is indicative that you have a stronger preference for that specialty. So in this example, the student has a stronger preference for internal medicine, family medicine, and psychiatry. That's not to say that if you were interested in pathology, you throw that out the window, but if you had never considered these 3 specialties on top, this is now an indication that you may want to start considering those, and you may want to tailor some of your future opportunities to get more exposure to these specialties. Next slide. You can then take this even a step further and look at the difference in medical interest scales. And this shows that the brown diamond is your interest level to complex problems. And the blue square is the internal medicine mean for those who went into internal medicine and their affinity for complex problems. So it's just a way for you to judge yourself compared to individuals that are actually in that field now. Next slide. Other scales and inventories on the Careers in Medicine site that you may find helpful include the Physician Values and Practice Scale. And this uses your response to 60 statements to prioritize 6 core values found in physician careers. And similar to that list that I shared with you previously, but these 6 core values include autonomy, management, prestige, service, lifestyle, and scholarly pursuits. And your results from this inventory or this scale will help you determine how you want to practice medicine in your chosen specialty, rather than help you decide what actual specialty to choose. Another inventory is a physician skills inventory. And this is an inventory that allows you to go through a self-assessment utilizing 47 skill statements and descriptions to measure your strengths and weaknesses in 3 major transferable skill areas, which include psychomotor, problem solving, and counseling skills. Next slide, please. The specialty indecision scale is another scale, and this uses 35 statements to measure 6 major areas of concern common to medical students considering and selecting specialties. These include readiness, information, identity, barriers, indecisiveness, and self-doubt. And lastly, the residency preference exercise. And this helps you consider and evaluate your requirements, your priorities, and your preferences for your residency or fellowship training, and then allows you to search and compare programs based on these criteria. Next slide. The second part of the Careers in Medicine site is to explore options. And this can be done in a variety of ways, including reading about different spotlights and profiles that are available on the Careers in Medicine website. You can also look for shadowing and research opportunities, and you can network and attend different resident panel discussions. So how many specialties actually are there? There are 120 specialties and subspecialties. You can go ahead and click. And 53 specialties available for residencies. So you guys have a lot of choices. This is a list to start you all off. And some of you are very familiar with this. Obviously, this is not an exhaustive list, but some of the specialties that you see, family medicine, internal medicine, peds, OB-GYN, gen surg, are part of your core clerkships that you do throughout your medical school training. The right-hand side of the screen, the P3 errand, is an acronym that we use here at my institution just to bring up some of the other specialties: psychiatry, pathology, physical medicine and rehab, emergency medicine, radiation oncology, radiology, diagnostic and interventional, anesthesiology, neurology, and dermatology. You may have other interests as well that you want to consider. Do you want to pursue a dual degree? A master's in public health, a master's in business administration, a PhD? Do you like working with your hands? Do you like woodworking, crafting, sewing, things like that? That doesn't necessarily mean if you like working with your hands that you automatically have to go into a general surgery career. I love doing procedures, and I am far from a general surgeon. So I think just knowing what you like and what you're willing to put up with is really important. Is advocacy and global health important to you? Or are you interested in research? Research can be clinical research, or it could be wet lab research. So this is an example of another area on the Careers in Medicine website that is available to you that provides information about clinical and research opportunities. So for some of you that may have time between first and second year, like during the summertime, this is a site that you can utilize to see what opportunities may be available for you. So now to third year. What can you do as a third year student? I would say first and foremost, give every clerkship a fair chance. Go into every clerkship thinking that you may never have the opportunity to see that specialty again. Talk to people in that specialty. All residencies are going to be hard, regardless of what you choose. But the more you talk to the residents and find out what their future plans, thoughts are, how did they get interested in this specialty, it's going to be really important. Also, talk to your attendings and ask them their thoughts about their specialty, their advice, any foreseeable changes that they think are going to occur in their actual specialty, and how that will change the landscape for that specialty. Try to score the best possible you can on your shelf exams. We know you guys are busy. We know you have a lot on your plate. But if you can score well on your exams, as well as try to get good comments on your evaluation for your dean's letter, these are all things that you can control that can really help you get into one of those more competitive specialties. And research different specialties. Again, talk to as many people as you can. Read the spotlights on the Careers in Medicine site, or even in specialty-specific magazines or journals or online. Find people who have the same value system as you, especially in the fields that you're considering, and talk to them. Talk to your upperclassmen to find opportunities and to find out who they've reached out to. Who are their go-to people? Continue to do your research. So once as a fourth year, some of you still may be struggling with what specialty to pursue, and it's not the end of the world. You still can get exposure. You still need to talk to as many folks as possible. Take some of these inventories again. The results may surprise you. You can consider doing a research year or doing what we call a pre-residency fellowship year. You can pursue other scholarship opportunities, such as a Fulbright scholarship, which allows U.S. students to pursue graduate studies, conduct research, or teach English abroad. There are a lot of opportunities still available to you, even if you don't know what specialty you want to pursue. Next slide. So in conclusion, choosing a specialty can be really tough and really daunting. We've all been in those shoes, but it's important to be true to yourself. Talk to anyone and everyone. Seek opportunities to increase your exposure. Question yourself on what your likes and dislikes are and why you feel that way. And seek mentors, advisors, advocates, not only locally at your institution, but elsewhere. On that note, I hope you found this brief presentation helpful. I wish you all the best of luck on your journey as you find your true passion in your specialty of choice. And I will turn it back over to Ms. McDaniel.
Thank you so much, Dr. Shah-Patel. I'm going to stop sharing your screen. Turn my video back on for a moment. Thank you so much for that informative and engaging talk. We definitely look forward to some questions at the end of our hour today. And I would just remind all of our participants, feel free to use either the chat or the Q&A function to send your questions directly to our panelists tonight, and we'll be answering them after the next presentation. So we are now going to transition over to our last speaker of the webinar, Dr. Raghu Adiga. Dr. Adiga is the president and CEO of Liberty Hospital in Kansas City Metro. He has been an infectious disease physician in Kansas City since 2004 and worked as the chief medical officer at Liberty Hospital for the past 6 years before taking over as CEO. Dr. Adiga is a fellow of Infectious Disease Society of America, or IDSA, and has been recently awarded one of Kansas City's Healthcare Heroes from Ingram's Magazine and Kansas City's 20 to Know in Healthcare by Kansas City Business Journal. Definitely an impressive resume. And with that intro, I'm pleased to hand things over to Dr. Adiga to present on the topic of interview tips for new physicians. And I'm going to go ahead and take it off video and share my screen, Dr. Adiga. Give me just 1 second.
Okay. Thank you. Thank you very much for inviting me to speak today. And also, it's a great honor to be speaking to all these young minds. We've all been there before, and it gives me a great pleasure to talk to all of you. There is going to be some amount of overlap between what Dr. Patel talked about, as well as what I'm going to talk about, as it is a continuum of what you want from your life and what your career goals are. She spoke mostly to the medical students about what specialty they're going to be choosing and how to get into residencies for the most part. My speech mostly is going to be geared towards the residents and fellows who might be listening. However, there's going to be some tips that you can certainly use for your residency interviews as well. So with that in mind, let's start with the first slide. So this is kind of giving you an overall picture approaching the first job search. I'm talking to mostly the residents who are looking at fresh doctors who are looking for jobs, but it could also be somebody who's just been in their first job and looking at something else as well. But typically for people who are in residency, they need to be starting fairly early, at least a year and a half before your job that you want to start. You need to start preparing. First of all, it's going to be defining what your career goals are and life priorities are before you look into it. I'll talk a little bit about that in the next slide. But the first things you want to look at your resume and make sure that that's up to date. And sometimes it needs to be updated frequently if you're publishing a lot or doing things that can look good on your resume as well. And then, of course, you need to review your digital footprint. I'll talk about it in a little bit. And most important of all of that is cultivating your connection networks during your residency, just like how Dr. Patel talked about issues, the connections that you need to be doing during your studenthood. It's also similarly important. And of course, there are job board options that you can look at. We'll talk about that as well. Next slide, please. So again, starting with setting priorities, what's important for you and your family? Next slide, please. So many job search depends on starting with geographic location. Again, we see this very often as we recruit physicians. Even though I myself have not been looking for a physician job for a while, I've had a lot of help from our own physician recruiter and our VP for physician services, who really gave me a lot of insight into what goes on. And that's what I'm going to be talking about. Vast majority of people who we end up recruiting have some sort of local ties, either the family or they've done their residency around here or they've gone to school. That really has a lot of attraction for a lot of different people. And then many of them may have had a family already during residency or fellowship, and then there are different needs than what they had thought about while they were students. So those become important. And then practice type. This is also clearly making distinction between each person where they end up at. Some people are obviously very much interested in continuing their academic life, so they want to be in university type setups. And a few people, on the other hand, are more interested in pure clinical work, not as much into teaching or research, or some may want both with some sort of a hybrid system. So that really kind of becomes important. Now, who is your employer? Do you want to be employed by a large system or an independent group, or is it a solo practice that you're going into? So that also kind of separates you into different pathways. Each pathway is different, and the clinical autonomy that you get in a solo practice is obviously a lot higher than what you would get in a huge system employment. But on the other hand, there are a lot of risks in the operation and financial side with the solo practice. So this also is an important distinguishing factor. And then what are your future goals? If you're in academic situation, your advancement, are there enough opportunities to become a full tenured professor? Or is it important for you to have, some named position in the academic situation, or publishing is important for you? Or in a private setup, do you want to be a leader, and are there additional skills that you need to get? So all of those kind of things you will have to look at. Then, of course, expected compensation and benefits, they do play a role in the priorities, and I'll talk about that at the end. And as it goes for a lot of different jobs these days, it is quite important that you pay attention to the work-life balance. I know a lot of younger generation take a lot of heat for putting a lot of importance to it, but it truly is important, because we see burnout quite a bit in the physician profession now, and pandemic has gotten that really worse. Next slide, please. So this is just kind of a line diagram. You can actually look at this article in the Journal of Graduate Medical Education, kind of gives you a little more details about where to start and where to head. And I talked about most of these. Next slide, please. So in the beginning, again, building a professional network is quite important. And this typically is inside your organization. There are advisors, program directors, mentors, they help you a lot. But it also goes to outside of your organization as well. as you go into conferences, meetings, things like that, you develop relationships with people in your field. That is quite important. And of course, you want to be visible through your presentations, committees, and casual encounters as well. And then reviewing your digital footprint. This is becoming more and more important. Of course, your private social media could come back to haunt you if you were very opinionated. So you need to be careful as more and more employers are looking into that, especially if you have not set privacy control. So I would tell people to start behaving as if, do you want to look at this 10 years down the line, and can you stand by it? So be careful with that. And then LinkedIn is also a good place where you can start. I mean, you should have started it during, medical studentship as well, but continuing that into the residency and developing a resume and being visible is certainly important. And of course, we talked about updating the curriculum vitae. Other thing I didn't talk about is references. References do matter for the jobs. And during residency itself, it would be good to kind of figure out who are the professors that you're going to be talking to, who could be your good references. And you want to also have some colleagues as well. Next slide, please. So next strategy, obviously, is to start looking for the job. Where would you look for it? Of course, now it's the online postings are the most common, and there are several different job boards. I've just listed a couple there. There are more than that. Practice Link and Practice Match are the ones that physician recruiters look into quite frequently. So those are the sites where you can not only search, but also you can post yourself as well, just like any other board where you're putting your details there, as long as you're careful about how much you want to expose yourself. And then specialty society websites, American College of Physiology, American Academy of Family Practice. There are several other societies, depending on what specialty you're in. Their websites are certainly helpful. And during the days I was looking for my jobs, it was looking into journals, New England Journal, JAMA, Infectious Disease Society journals. I used to look through them, and they do still post them, and it's of course on their website as well. And then eventually, if you know what area that you want to go into, what hospitals and hospital systems are there, certainly you can go to their websites as well. And of course, recruiters will be looking for you as well through your program director, and speaking with them certainly is a good strategy. And physician job fairs, and certainly using your professional network that you've already developed will be a lot of help. Next slide, please. So next step, after you've looked at some of these and you're getting ready for an interview, typically what happens is there is a telephone interview first, and that leads to eventual site visit. Most often, the first phone call is from a physician recruiter from the prospective job, and they'll be doing this, what's called the scoping call, and they kind of have, that's their profession. They're really good at it, so they can figure out what your interests are, and then that'll lead to a physician typically making a phone call. So preparing for that is important. You can certainly do the research of the job that you're looking at. In these days of internet, it's a lot easier to learn more about the job, about the facility, and the people associated with it. Having that really gives you an upper hand in these interviews. And of course, these are all simple enough things, but having heard from our recruiter, people don't always pay attention to these minor details. It does make a difference. The first impressions are quite important. So set up the interview in a quiet professional space, pay attention to the connection, keep the distractions to minimum, and of course, be confident, but not cocky. And of course, there are a lot of routine questions that's going to be asked, and be prepared for it. So next slide, I'll talk about the questions. These are some of the typical questions you get asked, and tell me about yourself. That's a very common open-ended question. So being prepared really gives you an upper hand on how much you want to reveal yourself, and it really can go anywhere. So you want to be professional and talk more about your goals, and let them ask you leading questions. Now, another very open-ended question is also, what's your ideal job look like? And that really, again, is a probing question to see if you really fit to what they're posting. So you want to really understand that. You don't want to lie, but on the other hand, you don't want to be so narrowing yourself down that you're not going to be considered for that job. Then, of course, the college schedules, and do you like more clinic, more something else? All of those questions will show up after that. Specific clinical interests. What I'm talking about is maybe a cardiothoracic surgeon might want to do more of a heart surgery, not the thoracic surgery, those kind of things. And then, of course, what is your top priority in deciding between different job offers? So if you already are looking at 2 or 3 different jobs in one city, then it may be a relevant question. And then, of course, they might ask, what's your compensation expectations? Here, I'd be careful. I would answer it if they have shared with you what's the range that they're offering. But again, that should be some of the last discussions you should be having. And then if you do have some issues with malpractice claims or any potential credentialing troubles that could be coming up, or any legal issues, you had a DWI, things like that, be careful and learn what you can disclose, what you need to be taken care of. You don't want to lie and later on found out something different that certainly could be problematic. And then, of course, there will be lots of questions about family and other interests, and they're trying to gauge if you are really interested in the geographic location or the particular facility. So those are the routine questions. Next, please. Next comes the site visit. And so when you go to a particular site for the interview, you obviously, again, these are all housekeeping stuff. You want to get there early enough and make sure that you thank everyone, not only just the physicians who are interviewing you. There are a lot of other staff that have put in a lot of effort into it. It's always important. And, stay away from fiddling with your phone and be humble. The things that you want to look at is the EMR. What EMR are they using? Is it something that you've used to during your residency, or is it something else? And a lot of surgeons obviously want to kind of make sure that, if it's an orthopedic surgeon, is it a Stryker shop or is it a Zimmer shop? And all those things really become important. And of course, you want to know about the patient volume. It's already there, or do you have to grow them? What's your block time if you're a surgeon? Are there enough support staff? Are there enough physician extenders that they're going to be giving you? Is there marketing support? And of course, you want to figure out what's the timeline for your follow-up and decision making. You also want to put a sort of a detective hat to, these are all subtle things that you're going to have to figure out. You can't directly ask, but you can, when you make a site visit, you can figure that out. Some of the things you can ask, of course, what's the organization's vision and goals are, but you have to kind of understand the culture, and is there enough administrative support? How's the group? This becomes a really important thing, because what makes or breaks your career is your partners that you're going to be working with for a number of years. Is there a mentor figure there? And how is the relationship between the partners? And how are the other colleagues and staff treating the partners? Do they have respect? That really makes an important impression. Next slide, please. So this is the last slide I want to talk about, because compensation is important, but it's not important. When everything else fits in, the compensation makes very little difference, because vast majority of the jobs, depending on where they are, their compensation are fairly set. Your ability to negotiate a whole lot is limited. The difference in compensations differ from, of course, geographic area and what type of job that is. And of course, remote areas and smaller non-academic entities pay more, but it does come with different expectations and different lifestyles and circumstances. What people don't know, especially when I was in residency, we are not taught many of these kind of things, especially compensation models. There is a lot of variation. First year or two, most of the physicians are given a fixed compensation. There's a guaranteed compensation. And after that, you typically move into production-based model. Not all jobs are like that. There are some jobs with a fixed salary forever. You just have to maintain certain production, but otherwise it's the same salary. But in the private practice world, especially clinical work, a lot of jobs are still production-based, what's called RVU. And there will be some incentive bonuses and other benefits and potential loan repayments. So you'll have to probably understand that very well. There is a market survey data that's available. You can actually get it from MGMA or other sources mentioned there before you head for the interview. In this area for this kind of a job, what's the range? You can typically understand that as well. Now, you need to know that the employers are limited by a lot of regulatory issues as well in how much they can pay. There's typically a range, but anything beyond that, they're going to have to justify so that the feds don't come after them. There is a fair market value and commercial reasonableness that they have to be adhering to, especially considering there is a potential for Stark Law and anti-kickback statutes that could play a role. So that's kind of in a nutshell, what you look at for compensation. Next slide, please. I do list here a few references that you can look at. And most of this information is given there as well. Next slide, please. Thank you very much again for this opportunity. And if there are any questions, certainly we'll answer them. And I can also be reached at that email address if you need anything after this. So thank you.
Thank you so much, Dr. Adiga and Dr. Shah-Patel. We had excellent content presented tonight by both of our speakers. And we are going to transition now into the question and answer portion of the webinar. We've already had a number of questions submitted. We'll start with those, and I would encourage everyone else on the phone to please submit any questions to our excellent panelists so we can get your burning questions answered. The first question we have, I'm going to direct to Dr. Shah-Patel, and it's really around specialty and choosing a specialty. You gave such nice considerations on all the things you should look at before choosing a specialty. What happens if you get into your selected specialty and you decide it's not your passion? What do you do at that point?
So that's a really great question, Libby. And I think, the first and foremost thing is to talk to your mentors. Are you sure you're not liking it for the right reasons? Is it just, life is tough right now? Because unfortunately, like I tell my students, life doesn't stop once you get into medical school or get into residency or into, your first job and things like that. Things are stressful all around. So I think reaching out to your mentors, reaching out to those that you really trust. I know a lot of residents have really great program directors that are very trusting. When push comes to shove, everyone's bottom line is that they want you to be happy. It's miserable from a program director's standpoint to have a resident that is miserable and that doesn't want to be there. They will bend over backwards for you, but you have to be honest with them. So I would say first and foremost, do some self-reflection on your own or with a family member or, someone, a close friend. Then reach out to your program director and have that open discussion with them. There are certain opportunities that are still available. You can still go into the match again the following year. There are some financial repercussions when it does come to the program side, because your funding is based on the initial match that you went into. So whatever specialty you matched into, that's what funding you are getting from the government for that training. However, like I said, it's more important, and programs do see this, that they want you to be happy. You don't want to continue in a specialty that you're not fully committed to. It takes too much out of you to go into something that you're going to be miserable at.
Excellent answer. Thank you so much. Dr. Adiga, the next question is for you. You nicely outlined all of the considerations, or a number of the considerations you should take into account when interviewing. Can you talk a little bit about how long of the process might take from the time of the screening interview to the face-to-face, and then from when a decision might get made?
Yeah, thank you. Those decisions obviously vary depending on each individual circumstance and the job that's been posted. Typically, in our situation, when we have a job that's been posted and our physician recruiter makes a contact and does the scoping interview over the phone and makes a decision after discussing with all of us to bring a candidate down, typically we are able to get that arranged within a matter of 2 to 4 weeks at the most. And then after the interview process, and say, for example, the individual who's doing the interviews has already done a few and has looked at some of that and doesn't really have a whole lot of other places to look at before making the decision, it may take another month or two more. To actually start the job itself, it's going to take a lot more because we have to consider several other factors, which is licensing. So getting the state license, especially if the resident is coming from a different state, that's the most time-consuming process. And then, of course, a lot of other credentialing with hospital and the credentialing with payers also take time. So we're talking about a few months.
Thank you. Thank you so much. Dr. Shah-Patel, a question for you around, in terms of choosing a specialty, we know that there are limited residency spots in each specialty. How do you tell where the most spots are available?
So there's lots of great resources online. Obviously, reach out to your mentors first, but you can utilize FRIDA. Careers in Medicine has opportunities, or you can very easily see things. Doximity, there's also a website called medmap.io, and I can put that, or I can send that to you, Libby. But that actually shows you the entire United States, and you can search by specialty, and then it will show you all the opportunities available across the nation in that specialty, and then have direct links to each of the programs. So there's lots of opportunities there.
Perfect. Dr. Adiga, you nicely outlined the questions that you might be getting in an interview setting. What are some questions that you should, or what are some things that you should not say in an interview?
Try to stay away from the discussion about politics. That's number one. I mean, most of these are common sense things. And as I talked about, I think the compensation part, that is something that probably should be kept to the end to discuss. But beyond that, I think being honest and how you would, talk to anybody respectable, whether it's in your program or anywhere else, I think that's the most important part. There isn't anything that you really can't. It all depends on the circumstances of discussion. So.
Thank you. We had a comment submitted as well that said, please get involved in advocacy in any capacity. It's extremely important as we are facing significant headwinds from payers and regarding scope of practice. I would echo that comment 100%, which is why we are such strong advocacy organizations at the state medical society level. For either of our presenters, any comments you want to make about advocacy and having a background, getting involved in medical school and residency programs, how does that help?
I'll start. Obviously, advocacy is very important. I think not very many students and residents understand that because you're so focused on gaining knowledge, clinical knowledge, and not necessarily paying attention to the business side of medicine. But once you get out on your own, you realize how much of impact a lot of other things have on your practice. Even though individual practice, solo practices have kind of moved away and become less common, and now it's mostly employed physicians, still it is very important. Even if you are employed by a big organization, for whether it's related to payers, whether it is related to, as they mentioned, their scope of practice can really be quite problematic going forward. So getting involved with your state medical association is very important.
Yeah, and I would just add to that, Dr. Adiga mentioned more from the business standpoint of view, but advocacy can be in multiple different ways. There's patient advocacy too. If there is a certain patient population that you are completely drawn to and passionate about, find that niche. That's going to fill your bucket when you get done with your training, and will get you through your training because you are truly passionate about that. So find those things that really inspire you, really make you push back and want to fight for someone or something, whether it be a cause, a patient group, a specific organization, and stay true to those. So there's multiple different ways to get involved in advocacy. And I think, at the medical school level, there are many of your attendings and faculty mentors that are also, very big in certain of these areas. So get involved with them, because it's easier to get involved as a student and then continue that as you move forward, because you have the most time right now as a student, even though it doesn't seem like it, you truly do. So.
Thank you.
I agree there. I mean, a lot of us went into a profession with, some ideals. That's what drives all of us to get into the healthcare field. So that don't let that burn out of you. Keep it going, and advocacy is one way to keep that going.
A question for Dr. Shah-Patel. When looking at specialties we are interested in, how do we find information on if we are a competitive candidate and will be able to match into that scope of residency?
So that's $1 million question now across the board, especially with STEP becoming pass-fail. A lot of the previous data that's out there, charting the outcomes and things like that through the AAMC or through NRMP were based on STEP scores. So I would definitely say utilize your advisors, utilize your medical school connections with local program directors to find out where you lie and if you are competitive or not. Find a mentor in that field that is familiar with the process. If you are in a medical school that maybe doesn't have that specialty as part of their training or whatnot, there are plenty of mentors out there that want to provide those services. And that's where I had mentioned briefly social media. Social media is a big one. I see it all the time on there. People saying, do you not have a home program in dermatology at your institution? Please reach out. I want to help. So I think a lot of it goes back to the networking.
Excellent. The next question is, how do you recommend students approach away or extramural rotations in fourth year? How can we best use these to explore our interest and prepare for residency?
So away rotations, especially now that some of the limitations have been lifted through the coalition because with COVID and all of that, away rotations are your way of finding out, one, if you like the location, two, if you like that institution and the way that it's being run, and three, if you are a good fit. Just as much as you want to shine at that away rotation, it's also your opportunity to find out if you will be happy there. You have to remember, residency is a long haul, right? Anywhere from 3 to 7 years, depending on what you're choosing. So you have to make sure that you can see yourself in that realm. I think in order to shine, I usually tell my students for away rotations, try to do a rotation in that same field locally first before you go away on your away. It's very expensive to go, from Arizona to New York if you've never stepped foot in an OR to do plastic surgery rotation, and that's going to be your first rotation. So definitely strategize with your advisor as to when the best timing would be in fourth year for you to do the away rotation. And then when you are there at the away rotation, if you do not have the opportunity to sit down with a program director, be proactive, take the initiative to make that appointment with the program director. It's very daunting oftentimes to go to a coordinator and say, I'd like to meet with, program director so-and-so, but just try your hardest and step out of your comfort zone, because you've gone all the way out there to do this rotation. You want to make sure that you meet with the important people that are going to be making these decisions down the line.
Great. I think we've answered all the questions that have been submitted. We'll take a moment to see if there are any final comments from our presenters tonight, and then I'll just say a few words before we conclude. Dr. Adiga, did you want to say anything else?
Yeah, the only thing I want to add is that, obviously finding your job as it is so important for you to find the perfect job, it is also as much important for the employer to find that right person to fit that job. So it's a two-way street, and it doesn't work if we find somebody who is not going to be here, they're unhappy after a few months and then ends up leaving. Makes a huge impact both for the employer as well as the person who took the job, both financially and otherwise. They say, one physician who we hire and lose within a year costs any organization anywhere between $100,000 to $200,000 at the minimum. It's probably a lot more, especially if it's a surgical field, and we've invested a lot. So it's very important that we understand each other very well before jumping into that decision. So that's all I had to say.
Thank you. Dr. Shah-Patel, we did have one final question come in, so perhaps you could answer that and then any closing remarks. The question is, should you still pursue a competitive specialty if your advisor discourages you due to the competitiveness?
So I think you have to really sit down and figure out why you want to pursue that competitive specialty. If you can't see yourself doing anything else at all, then absolutely try to pursue that, knowing though that the more times that you go through the match, the harder it is to actually match. But there are things that you can control. You can do a pre-residency fellowship. You can do a research year if publications may be something that you do not have enough of on your application. So I think you have to look at it holistically. And if there's another way to get to what your true passion is, then that could be an opportunity as well. A perfect example I give students is for orthopedic surgery. If you like orthopedic surgery because of your sports interest and things like that, and maybe you don't have the publications or the scores or something to that extent, you can go down the family medicine route and still get into sports medicine. So there's other creative ways to still get to your end goal. You just have to think a little bit outside of the box and be creative. As far as parting words, I would say, this is a really, really exciting time for you guys. It is scary, but it's exciting. This is what you've worked so hard to get to. Give yourself the grace to flip-flop specialties. Like I shared on my very first slide, 1 in 4 students will switch specialties from what they first thought. It's actually up to, you'll switch specialties 3 to 5 times throughout your entire journey, and that's normal. It's okay. Just talk to people, try to get exposed, and give yourself the grace to have patience with yourself to find out what your true passion is, and stay true to yourself. It's really important.
Thank you. We have amazing presenters on the webinar tonight with such great content. I just want to thank our presenters again, and I want to thank all of our attendees as well. We appreciate you taking the time to join us. Thank you again for joining us tonight, and good night.